Many of you are reaching out to WBZ Dr. Mallika Marshall with questions about the coronavirus and about getting the vaccine. Dr. Mallika Marshall joins us now live to answer some of those questions. And doctor, our first one today is from Sally, who asks, if I am 3 weeks post my second dose of the Pfizer vaccine, is it safe for me to get together with my family for Easter dinner?
Well, Sally, what a timely question, because the CDC just issued new recommendations for people who are fully vaccinated. And by that, we mean people who are 2 weeks out from their second dose of either the Pfizer or Moderna vaccines and 2 weeks out from that single dose of the Johnson & Johnson vaccine. And what they say is that people who are fully vaccinated can get together in small groups with other people who are fully vaccinated without wearing masks. They also say that people who are fully vaccinated can get together in small groups, I want to say that again, with unvaccinated people who are in the same household, as long as those people are not at higher risk for severe COVID-19.
And Sally had a follow-up question, doctor. She wants to know how long after someone has had the coronavirus will it take for them to test negative, and are they contagious until they do?
So we believe that people who have been infected with the coronavirus are no longer contagious about 10 days after their illness, as long as they only had mild to moderate COVID. People who have had severe COVID, they might be contagious up to 20 days after the onset of their illness. And even though someone's no longer contagious after that 10 to 20 days, they can still test positive for the coronavirus for 3 months or longer.
Our next question comes from a loving grandmother, Kathy, who writes, my 16-year-old grandson had COVID back in January. It is now March, and he has not regained his sense of taste and smell. I am so afraid that this will be permanent. Is there anything at all we can do to help him with this?
Yeah, really frustrating. It's a relatively common symptom of COVID-19 to lose taste and/or smell. Most people recover those senses within about 28 days, but a small minority will continue to have that loss of taste and smell for months, if not longer. So there's some doctors who are trying something called smell training, where people are asked to smell odors and have to sort of retrain their brain to remember exactly what that scent is. The other thing is scientists are working on developing an olfactory implant that can detect odors and then send signals to the brain. But obviously that's experimental at this moment.
Here's another health question. Barbie writes, can you please tell me how long after I get a mammogram can I have my COVID vaccination? I have an appointment today, 1 week after my mammogram. Is this safe?
So you can get vaccinated anytime after you have your mammogram. The concern was getting a mammogram after your vaccine, and that's because some women and men can develop swelling of lymph nodes in the armpit, which is a completely normal immune response to the vaccine. But sometimes it can be picked up on a mammogram and look like it could be breast cancer, even though it isn't. So people are suggesting, look, if you can try to get your mammogram before getting vaccinated, that's ideal. If you can't, then maybe push off the mammogram for 4 to 6 weeks after you get vaccinated. Most important thing is to make sure you don't push it off too long and you get both your mammogram and your COVID vaccine.
Yeah, those diagnostic tests, so important. Dr. Mallika, thank you so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. And if you have a question for Dr. Mallika, you can reach her one of 3 ways. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall. David?
Lisa.